Hi, I'm Cindy Crosby from birthsmart.com, and I'm sharing the 6 traits of optimal maternity care. Today's topic is that women have continuous emotional and physical support during labor. And as we talk about this, I think it's really important that we clearly define the responsibilities of the different members of your birth team. And when you hire a doctor or a midwife to be your medical care provider, their job is to oversee your care and to help prevent and deal with any medical problems that you might develop. Their job does not entail providing emotional support for you and physical support during labor. Some providers are able to go above and beyond and do some of that, but they're certainly not able to provide it on a consistent or continuous basis throughout your labor. I think many women are shocked to realize, especially if they have an OB in a hospital, how little time their doctor spends with them during their labor and birth. And so since their job is to provide that medical care, some women feel that it's really useful to supplement that care with a professional labor support or a doula. And a doula is simply a professional who's been experienced with birth. They don't provide any medical care. They wouldn't be messing with your IV or checking your cervix or anything like that. They would be more providing comfort measures to you and helping to inform you and educate you prior to your birth, help you to resolve any emotional issues or concerns you might have. When you're in birth, when you're at your birth, they'll be looking out for your comfort, trying to bring you blankets or pillows or drinks or turning the lights down or doing things to minimize stressors and distractions in your space. And there are many studies that have confirmed the effectiveness and the difference that it makes to have a doula at your birth. Several studies have come out that have suggested lower cesarean rates, lower percentages of assisted deliveries, lower need for pain medication, and overall a higher rate of satisfaction with your birth experience. And so it's a great option for many women, and if it's something that you feel interested in, I would really encourage you to research into your local options and interview a few doulas and see if you find someone who makes you feel comfortable. And when you're looking for that doula, I think that's the most important thing, your connection with them and your relationship. If you have a doula who's slightly less experienced than another, I think that connection you have really trumps other issues that you might be considering. So because of the great advantages of doulas, actually some insurance companies now are starting to cover and reimburse the cost of a doula. So that's something I'd encourage you to look into as well, especially if you do end up hiring one. And in some areas you might find doulas who are training and in the middle of their certification who might be offering to do births at a reduced rate. And so there might be many options for you. But if having a doula is not right for you for whatever reason, don't fear. You can still take advantage of labor support. The members of your family, your partner, husband, or friends or other family members who you've chosen to accompany you at your birth, you can help to prepare them to be effective support. This is a great book called The Birth Partner by Penny Simpkin. I really recommend this to everyone. It's great for pregnant women to read as well, but it's actually written toward those people who will be there supporting you during your labor. And it's a great book to read all the way through, but it also condenses information into different charts and diagrams, and it has lots of visuals, and it's easy to look things up. So it doesn't have to be read completely if you're pressed for time, or it's a great thing to have in the bag with you if you go to the hospital for your birth. So those are just a few ideas and options for you, and I would encourage you, no matter what type of birth experience you're having, to try to create an environment that's not going to be stressful, and that you're preparing your team to really be unified in supporting you. You're the only one that actually can give birth to your baby, but it's amazing the strength and power that comes when you have a team united around you, offering you that strength and support. And so do be cautious in allowing people into your birth space who might bring stress, create stress for you. And don't invite someone to your birth just because they want to be there. It's your day, it's your experience, and a more stressful environment actually can impede your labor progress. And so be aware of that and try to prepare yourself and set yourself up for success in that regard. Thank you so much for joining me, and I wish you all the best with your birth.